The main reason most of the candidates come to do our extraction course is because they've not learned how to do it in dental school, period. I started noticing something that the students who were going through the programs learned basics, but when they came out, including myself as a specialist prosthodontist, when I finished, I found that there was no hands-on practical experience in teaching students.
I have done some general theoretical courses in Melbourne over the last few years, and while that gives you an understanding of the principles, it doesn't really give you the hands-on confidence.
And so then we came up with this concept where they would go from day 1 to day 5 with a specialist, where patients are picked. There is no, is this the right patient, not the right patient. All the patients are screened. They're screened medically, they're screened dentally, they have cone beam scans, they have study models, and the mentor knows exactly what's going to happen, and they're all simple cases. The course, the way it's designed, is what we call a one-on-one system. And as far as I know, it's not available anywhere else. Every candidate is assigned one mentor. That mentor is completely responsible for that student for 5 days.
It's great that the coordinator actually wants to know what you know and what you don't know after the first day, and then modify that accordingly for, I guess, your education for the rest of the week, and giving you cases that would be suitable for your skill level.
So during the 5 days of the course, from Monday to Friday, the candidates will get to do a minimum of 10 surgical extractions. So I guess candidates need to be aware, this is not a wisdom teeth course alone. It's part of the program. They get to do surgical extractions. Every case, they will cut bone and raise a flap to get a tooth out. But it's a combination of everything: broken teeth, fractured teeth, impacted teeth, wisdom teeth.